Hello, I am Dr. Bhavna Chaudhari, a consultant gynecologist. Today I am discussing a topic of preconceptional care. When a couple think of having a baby, they consult their doctor. And in the visit, what the conversation generally happens that we are going to discuss now. So the first we have to think of our age. If you are below 21 years, then your body and your mind is not ready to take the stress of all this pregnancy. So after 21 is the right age to have a baby, and till 34 years of age the ovulation and the number of eggs are quite normal, but after 34 the number of eggs in your body are depleted rapidly. So 21 to 34 maybe you say a better age to have a baby. Then the next point is your weight. Calculate your body mass index. It should be between 21 to 25. If you are too much underweight, then there is also a high risk factor to have a low birth weight baby, preterm deliveries, and also there is a lot of backache and body aches. If you are too much obese, body mass index is more than 26, then there are also chances of repeated abortions and bleeding and associated factors like diabetes and hypertension. So you have to think about weight loss, 10 to 15% of your body weight at least before planning for the pregnancy. If you are planning for a weight loss, then don't go for any unrealistic crash diet or a keto diet, because it causes nutritional deficiencies and it may harm the baby. Like if you develop a folic acid deficiency, then they may cause serious side effects to get the neural tube defects in the baby. So folic acid supplementation is very important to take before conception. At least you should start 2 months before getting pregnant. If you have chronic medical diseases, like already you have diabetes or hypertension or thyroid problem, or epilepsy, means history of convulsions, or asthma, you should tell the doctor your history. If you have hypertension or diabetes, then regular checkup and the medications you have to change the molecule, because some drugs are not allowed to take during pregnancy and in the preconceptional period. It may harm the baby's growth. Also, check out your HbA1c level in case of diabetes. If it is too high, then work on your sugar levels, do exercise, have a diet chart, and allow the HbA1c to come down to at least 6 or 6.5, and then only think of having a baby. If you have a thyroid problem, then the optimum level of thyroid level is very important for the baby's brain growth. First 11 months of the pregnancy, the baby's thyroid glands not functions properly, so it has to depend 100% on the mother's thyroid hormone level. So they should be at the optimum level, and the dose may be increased by 20% in first trimester if required. In case of epilepsy also, there are a lot of drugs which are contraindicated, so the molecule has to be changed. And if the mother has a history of recent convulsion, then there should be at least a 1 year period of free of convulsion, and then only she should think of having a pregnancy. Then the next one is vaccination. If you haven't taken the rubella vaccine, you should first take it. If you get the rubella infection in the first 3 months, then the baby may have serious complications of heart, eyes or ears. So go for rubella vaccine first. And so also the hepatitis B vaccination, the course you should complete first before getting pregnant. Nowadays we also recommend the cervical vaccine course, that is we have to take 0 to 6 3 doses. That dose we also can complete. Then the next one is if you are indulging in some addictions, like nowadays alcohol or drugs or smoking, it is becoming common in females in corporate world. So you should stop having that and change your lifestyle, and after planning only you should think of the pregnancy, because if during pregnancy you continue with that things, it will seriously harm the mental and physical growth of the baby. There are some genetic diseases which runs in families, like thalassemia and sickle cell anemia, which is common in our Asian countries. So if there is some history or if you have chronic anemia, then you should test for the HPLC or electrophoresis test. Then there are some rare diseases like autoimmune diseases or some muscular dystrophies or enzymatic error diseases. If you have such history proven in previous baby or in close relatives, then also you should go for that testing. So if you like this video, then share and subscribe and stay tuned.